Hi, so today we'll be talking about meningitis. This presentation was created by Ashton Tomasino, Hannah Taylor, Annalise Smith, and Lillian Villarreal. So the main cause of meningitis is typically a viral or bacterial infection that leads to the fluid buildup within the membrane coverings of the brain and the spinal cord, thus leading to swelling. So in the picture to the right, there are normal meninges, where no swelling has taken place, and below that is a case of meningitis where a fluid buildup has occurred and has led to swelling. So some additional causes that could result in meningitis include cancer, injuries, certain drugs, and other type of infections. Due to many different potential ways to contract meningitis, each can lead to either bacterial or viral meningitis. Because there are two forms, they do have different effects on the body and therefore need to be treated differently. Viral meningitis typically is the more common form, but it is also less serious. So to properly diagnose meningitis, it needs to be done by a professional through a spinal tap for cerebral spinal fluid. This is done by a needle puncture in the lumbar region of the back between two vertebrae, where they will extract the cerebral spinal fluid and send it to the lab to be tested. What they're looking for in lab is the bacterial meningitis typically has a higher white blood cell count compared to viral meningitis. Additionally, the protein concentration is higher in bacterial meningitis, but the glucose is often lower than viral meningitis. So overall, when looking for meningitis, they're looking at the protein, the white blood cell count, glucose amount, and they're compared and help to differentiate between bacterial and viral meningitis. So the prognosis, about 1.2 million people report being infected with bacterial meningitis worldwide. Without treatment, infected individuals only have about a 30% chance of living without treatment, and 25% of those survivors will suffer from long-term effects. Those long-term effects are like loss of limbs, paralysis, deafness, seizures, blindness, and impaired mental function. Of course, there's only a 25% chance of that occurring if surviving. Of course, you can live and have no long-term effects, but there is still a chance. Even with proper treatment and care, the death rates are still around 20%, and the risk increases with age, and it also depends on the type of bacteria that is associated with the infection, so those rates can fluctuate. So some of the risk factors for meningitis would be the main one being age. So it is known that younger children are at a higher risk, about 70 times more likely than the average adult. So they have new immune systems. So being exposed to infections like this, their body doesn't really know how to react versus adults, which had a longer lifespan to adapt to the environment. So another one would be where you live and the environment you're surrounded by, which can lead to like bacterial infections. Also, the smoke exposure and very large crowd gatherings, you are more susceptible to meningitis. Additionally, if an individual's immune system is compromised or has like certain previous medical issues, they are immediately at a higher risk of developing a viral infection due to the body's lack of like defenses against outside like pathogens. Lastly, even the majority of time, cases of meningitis are isolated. If anyone does come in contact with someone who is infected, you are like immediately at risk at contracting the infection. So lastly, some additional information to be covered is meningitis can be prevented through a vaccination before the virus is contracted. So many people growing up do typically get a meningitis shot. Also, the United States does have two types of vaccines. There's a first meningitis vaccine to be released in around 2005, and a meningitis B vaccine that was released a little later on. So they are offered and they are optional. And since the introduction of meningitis, the infection rates have been reduced to about 90%, proving that the vaccine has been effective for those that are vaccinated. So overall, it is highly encouraged to get a meningitis shot, so that way those that may come in contact with it are not affected or have long-term effects, but of course it is optional, and there are 2 rounds of vaccination. So this is a wrap on it, and thank you so much.